Now, over 350,000 persons living with HIV in Ghana are in danger as the government is yet to activate the National HIV and AIDS Fund. Advocates and civil society groups in the fight against HIV and AIDS fear for the worst if the fund is not activated, as the Global Fund has sent signals of cutting back its support to the country.
According to the National AIDS Commission, over 250,000 adults and over 12,000 children are currently surviving on antiretroviral medications. Additionally, over 235,000 children have been orphaned by AIDS. The survival of these persons is dependent on the free antiretroviral therapy and other essential medicines required in fighting the virus, which is supported by the Global Fund. During the amendment of the Ghana AIDS Commission Act 2016, Act 938, provision was made for the establishment of the National HIV and AIDS Fund to receive donations to sustain the fight against the virus. However, 6 years on, the fund is yet to be activated and operationalized. The Ghana HIV and AIDS Network, the network of persons living with HIV, and civil society organizations in health have attributed the recent rise in HIV cases among the youth to lack of education about the virus.
We are aware the Ghana AIDS Commission has been talking to government about the fund, but every year there's one excuse or the other. And we think that excuses are becoming just too many because lives are at stake. And if the Global Fund says they can support only half of that number, it means government must find the money to support the other half. Otherwise, we risk losing all of them. And we are saying this is not the best of situations. Government must activate the fund.
President of the Network of Persons Living with HIV, Elsie Aye, is cautioning of the dangers ahead if the fund is not activated as a national emergency.
We'll lose more young persons. There'll be more infection. The young people who haven't had enough sex education would go and get pregnant, or they'll be infected. Condoms, which is also a commodity which is used for prevention, is in short supply. People who want to even know their status, the kits are also in short supply. So where are we going?
The group has planned a series of engagements with various stakeholders to press home their demand.